Good evening. First tonight, the A&E department in crisis. Things got so bad last week, a medical officer normally reserved for major incidents such as terror attacks was drafted in to treat patients in corridors and on ambulances at Worcestershire Royal Hospital. West Midlands Ambulance Service called it an unprecedented move and demanded it following delays in treatment. One senior clinical member of staff at the hospital said colleagues had been struggling to cope with the number of admissions, describing conditions in A&E as a third world situation where only the very sickest patients can be treated properly. Our health correspondent, Michele Paduano, broke the story and joins us from outside the hospital now. Michele.
Well, we have finally had an apology from Worcestershire Acute Hospital's NHS Trust. They say that the service that they have provided hasn't actually been acceptable. But 4 months after we first spoke to a paramedic about the chaos in the corridors, we haven't actually managed to secure an interview from anyone from the Trust to explain to us why this situation has gone on for so long. Back home tending his garden, but it's the way patients were tended in hospital that has disturbed Roger Barry. The 73-year-old heart patient says he spent more than 15 hours in February on a trolley in the corridor at Worcester Hospital.
I got my troubles. I felt people were not being given water or toilets. They were shouting for a drink and water. And I did get up and I handed one or two of them water.
His next-door neighbour in Stourport-on-Severn says her terminally ill husband spent 11 hours just 2 weeks ago.
I don't think they should wait that long. No. I think the trouble is they're taking too many folks there.
Last Friday was the last straw for West Midlands Ambulance Service, and they called on a doctor normally deployed for disasters.
I don't think anyone, the hospital themselves included, would dispute the fact that something has to happen and has to happen relatively quickly here because, of course, you know, we're in April at the moment, which is traditionally a slightly quieter time of the year. We cannot afford for this situation to carry on.
There were no ambulances left to respond to 999 calls across the county, and they had patients with heart-related chest pains and possible blood clots who were simply not being treated. This was no surprise for a union representing ambulance staff. One of their paramedics whistleblew about chaos in the corridors as long ago as January. They blame cuts and a lack of organisation.
There's been a problem in the A&E system for years with underfunding. There's been problems in Worcester for months. We've had people who've come forward and blown the whistle over a long period of time. The government have failed to act, the trust have failed to act, and unfortunately the ambulance service have had to intervene to save the quality of care to the patients.
The trust is to face action from the Care Quality Commission due to continued problems, which include 5 emergency consultants resigning, voicing safety fears. They say it's been under extreme pressure, with more patients stranded who were fit for discharge than at any time in 3 years.
Michele, this has been making headlines all day. What's the latest?
Well, there was a meeting today in a hotel in Leicester with all the parties brought together, and the NHS Trust Development Authority, which is the body that actually oversees hospitals, said that they are putting in an improvement director to the hospital. Now, this is somebody that is normally brought into hospitals that are actually in special measures. They're also talking about some senior clinical staff to actually support the accident and emergency department. And I understand too that there were actually interviews yesterday and they're hoping to appoint some new consultants. But the real issue here is, why didn't they get a grip of this sooner, and why didn't the system actually sort out the problems in accident and emergency before 4 months had to pass by?
Michele, thank you.